I didn't expect to get a podium. I'll try not to abuse the privilege. I'm really glad that we're having this discussion. I think that this is
Don't hold the mic.
okay. This is we're beginning to get to some of the really important questions. I ask myself, what's changed in the last 5 years? And the answer comes in several classes of things. Obviously, there was the Great Recession, unanticipated by anybody, as various speakers have said. Secondly, in medical care, the formation of specialty groups, particularly in large ones, have taken away a lot of the services that used to be provided in hospitals, and that is expected to continue. And that's, I think, a very serious and important change. Third, there has been the Affordable Care Act. Nobody has mentioned that. That sets a whole new different structure of incentives and changes that are really going to be very important from now on. And I really think that those opportunities need to be taken advantage of. And finally, there's been a spread in the last few years of the use of electronic medical records, particularly by primary care providers. And we are now very close to the reality of information being shared with the patient, with a primary care provider, with a hospital, with a specialist, that just seemed kind of a distant vision several years ago. We're there. Things like medical homes, the possibility of clinical integration, which you folks have now become involved in, taking advantage of information technology and records to have a different relationship among the different constituent parts, so that care is better, care for the public is better. One of the speakers, a doctor, mentioned the importance of primary care, that we have the best primary care doctors in the country. We have the best network. They're the best trained. If we need a vision, perhaps the vision should start there rather than end there. I think it's important that, particularly if specialists are not going to offer a greater chance of revenue for Health Alliance, that it's important to start with the primary care providers and have an alliance between the primary care providers and the hospital. It just simply makes sense. It would require a kind of different kind of relationship in regard to control of the process, but I think that would be a good thing. So that, to sum up, I see electronic medical records, I see family practice, I see medical education, very important. We've had the Institute for Family Health here for 30 years, thanks to Maurice Nechi. And it's wonderful. It really does something and provides first-class training for dozens of people. It provides us a way of staying alert and up to date on technology. We need to expand that. We need to get this hospital to become known worldwide for that kind of relationship. I think we're really in severe financial problems here, and I think that needs to be recognized. I think no matter what the health department comes up with as the amount of money it's going to give it, we're still going to have to raise 10 scores of millions of dollars of bonding. And if you've noticed, there's some question now in the bond market as to whether hospital bonds rank the same way municipal bonds are riskier. We need to have our house sufficiently in order for the answer to be positive, in that with the state money and with the bonding, that we can survive as an independent institution. And I would really like us to survive as an independent institution. One more thought. I think that it's very important, if you make alliances with people, make sure those alliances are with the best in the world. It doesn't do any good. When I was sick, when I needed heart surgery, I didn't go to Albany. I went to New York City, of course. You'd be crazy not to. I think we need world-class partners in order for this enterprise to succeed. Thank you.
The next speaker is Bob Stench.